Hello, my name is Nanette Manesses, inventor of Happy Tummy, and I am really excited to introduce a doctor that is amazing. She is a published researcher. She's a scientist, biologist, chemist, and she's been practicing for over 40 years. She is a veteran of the Army, and she is all about integrative, alternative, preventative medicine for everything from being able to get pregnant to during your pregnancy, after pregnancy, for everybody, grown-ups, elderly, and especially for developing a great healthy body from infant all the way to the elderly. Please make sure that you watch Dr. Elithorpe's videos.
Well, welcome. My name is Dr. Elithorpe, and I want to share with you what would you do to help support if you are breastfeeding, or even if you are unable to breastfeed and you're dealing with the postpartum stresses of what your body is going through after the delivery. So I'd like to tell you what we are recommending here at Tustin Longevity and have done research on to help our patients. With breastfeeding, there's a tremendous need for your breasts to produce, the ounces of milk that your baby is going to require, and you want that milk to be sufficient so that your baby can grow on this for the first many months of his or her life. And that milk is rich in protein, and it is rich in fats, because cells are made of fats and proteins. And what we show our pregnant women and our nursing mothers is that the cell membrane is a double layer. There's a top and a bottom layer to every cell membrane, so that the inside of the cell and the nucleus are protected like a ball. And that membrane is composed of a double layer of these very special phospholipids, a little phosphorylated fatty acid chain, and a very special fatty acid called linoleic acid, alpha-linolenic acid. These are the only two essential human fatty acids that are needed. And then protein. And you can see the whole cell membrane is composed of this. And by the way, these little globs right here are cholesterol. So we encourage our patients to consume sufficient proteins and healthy fats from natural sources, natural meat, natural chicken with the skin on it, and fish and pork. We encourage all these organic sources to consume, because your breasts are going to be in a state of demand to increase the metabolism for the supply of your baby. One of the other things that we do then to encourage that is to have them take a doctor's nutrition bar. We designed this bar, we've done the research and studies on it, to actually provide only organic, vegan-friendly, if you are not eating animal products, a high protein, 15 gram per bar, and 15 grams of fiber, because having regular bowel movements is very important to your health as well. So this contains a amount of carbohydrate from natural sources, foods, that will not make your glucose rise compared to the other protein bars out there. It will not make your insulin rise like the other protein bars that are out there. So that is why we designed it. We found that people have been eating so much processed foods, hydrogenated fats in Doritos and chips and restaurant foods and fast foods, that wonderful cell membrane, which needs the essential fats that I'm showing you right here, these essential fats with all these double bonds, they're destroyed to extend the shelf life of all these processed foods, so they can be there for months and months and months and not rot. Oxygen needs to pass through this gateway to the cell membrane, because this is, without the hydrogen positive ions here, it's a little electronegative. So oxygen, which is positive, makes this beautiful passage into the cell in this fashion. This is destroyed in all this shelf life extended processed fast foods out there. So you can see the cell is made of all this fat and cholesterol throughout here and protein. There are no starchy carbohydrates. So we try and help our patients to breastfeed on a protein-rich and essential fatty acid in their diet, and when they're out and about, so they're not tempted to stop at a fast food restaurant, that they take this protein bar that we designed, and we did all the clinical studies on this. The other thing that's very important for breastfeeding is the most important nutrient is water. You have to drink over half your weight in ounces, pounds as ounces. So if you're a 150-pound woman, you must drink 75 ounces of water. And if you're breastfeeding, you should increase that by at least another 10% and get closer to 90 to 100 ounces a day. The other thing we like to suggest to women, and I always remind them, when I was a young intern in medical school, we would help the women with their breastfeeding in our women's clinic for newborns and lactating women. We would cook up soft-boiled eggs for them to eat, to get in that fat and the protein. Now, we soft-boiled them because we didn't want it to destroy the fatty acids inside the yolk of that cooked egg. So that was one of the things that stopped the nausea of pregnancy and helped develop these little babies. Remember, we all start as a single cell, and you've got to make all these cells full of these wonderful fats and proteins. So you've got to have your water. You've got to have your essential fatty acids, linoleic and alpha-linolenic acid. You've got to have your protein, and we hope that you're getting them from organic sources. But even if you're a vegetarian, this is an excellent way to get those fats and protein in, is with the doctor's nutrition bar. The breast tissue itself is very much dependent on having adequate iodine. And so we have all our lactating women, all our pregnant women, but lactating women, take 1 iodine tablet a day. Women in Japan eat on an average 12.5 milligrams of iodine in their daily diet. They eat a lot of seaweed and vegetables rich in this from the sea, and their fish. And so this iodine tablet has 12.5 milligrams of iodine in it. This was developed by another family doctor, Dr. David Brownstein. And 1 tablet a day is what we ask. By the way, the IQ of the baby, even as you're nursing, will be enhanced if you have adequate iodine in your body as the brain is developing. Remember, the brain cell membrane is made up of 75% fat and 25% protein, and the other bodily cells are made of 50% fat and 50% protein. So you have to be mindful, if you want to have a high IQ on your child, to get adequate iodine in it. And in my experience as a clinician, I would say 96% of every adult or child that I have tested has been deficient in America on iodine. The other thing that is associated with a good immune system, remember, as you're nursing, you want to improve the immune system of your child, adequately gaining calories and weight. So we give them vitamin D, which helps the cells produce defense molecules that ward off infection as the baby is starting to develop its encounter with the world and the little viruses and bacteria out in this world, and on even the skin of the mother. So we give a mother her 1 tablet a day of vitamin D with vitamin K2 in it. You know, vitamin K2 has been known in all of ancient medicine to be associated with fertility. Vitamin K2, not K1, K1 is associated with clotting, but vitamin K2 is hyperconcentrated by cows and goats and that type of animal that produces the creams and cheeses and milk that is in the very early spring of every year. These cheeses and dairy products from animals, when they eat the early grass and the early spring clover, is very, very rich in vitamin K2. which is quite essential to the whole fertility and process of developing the baby, especially even in lactation as well. We also encourage them to use a healthy multivitamin nutrient while you're lactating that has the selenium in it. Remember, iodine and selenium are very important in breast health. The breast hyperconcentrates iodine and the metabolic demands of the breast for iodine go up during lactation. So this might help you with your lactation as well. The other thing we certainly recommend during lactation, because this is putting a stress on your body. The stress on your body will create damage to these cell membranes. So this shows a picture of what we call oxidative cell damage. And so just going through the process of pregnancy and the stress of being a mom, taking care of children and that newborn and all the breastfeeding demands, there's going to be damage just to be alive on the planet. And that oxidative damage is greatly reduced with the research we have chosen, because we're a science-oriented medical clinic here. We use the Juice Plus series. That's whole food fruit, vegetables, and berries in a capsule form. This is not a man-made vitamin. This is food. So this is berries, fruit, and vegetables in these 3 products right here. And then this also is from the oceans, the algae and oils that they take from it to help with stopping this free radical damage right here, this oxidative stress, and improving the oxygen delivery to the cells as well. So nursing mothers, drink plenty of water, eat plenty of organically raised fish and wild fish and chicken and beef products and even pork. And drink plenty of water. Get your sleep at night, because we heal at night as best you can while you're nursing. And then take certain nutrients, and maybe this will help you with Doctor's Nutrition Bar with your lactation, especially getting in 15 grams of protein per bar with 15 grams of fiber per bar. All natural, all vegan friendly composition, and it tastes great, which won't make your insulin and glucose levels significantly rise like these other cheap products out there called protein bars. And with that, I hope that your nursing time is enhanced and you have a better and healthier baby for it. Thank you very much.